Pramod there. Welcome to yet another edition of CTOX by BrandKnew. As I always maintain, one of the fringe benefits of being a journalist or an editor is that we get an opportunity to interact and get up close and personal with thought leaders from around the globe who, through their razor sharp focus, tenacity, resilience, make things happen and make dents in the universe. Today, we have privilege to kind of look at a conversation with Mr. Pramod Balakrishnan, operating partner healthcare in full protein form at Ashmore Capital. Welcome to the show, Pramod.
Thank you.
So let me begin at the beginning. Very curious to know about your growing up years, your childhood memories, early delights and inspiration.
Wow. So my dad used to be in the Navy. So I've kind of lived all over India.
Nomadic.
Yeah, okay. Went to school in Bombay, Delhi, Calcutta. Along the way, learned a lot of languages, so I can actually speak or understand at least 5, 6 different languages.
Wow.
From Marathi to Punjabi to Bengali. Speak Bengali quite fluently. And I belong to Kerala, so Malayalam and Tamil and all of that comes quite naturally. So I would say a true Indian in the sense that having lived in north, south, east, and west, I think that helps you. That helps you understand people, understand how complex a country India is, and fascinating. That was my early days. Schools from missionary schools to the government-run central schools. I went to college in Calcutta.
Kendriya Vidyalayas,
Kendriya Vidyalayas. And then finally went to college in Calcutta at a place called St. Xavier's College. Did my CA from Calcutta. Did a short stint with the Tatas in India. And then came to the Middle East. The last 30 years has been in the Middle East.
As I said, travel is probably the best university, which is not given due respect or due acknowledgement. You spoke about getting into chartered accountancy. What is the trigger point? Did you have a sense of numbers right from childhood? Was there some other inspiration in the family that you took up chartered accountancy, or what was it? Was it intrinsic? Was it external?
I'll be honest. It was accidental. Okay, it was accidental. I was one of those kids who I think in my younger days really did not know what I wanted to do with my career.
Join the club.
I was quite playful. I would play every sport, whether it was cricket, football, hockey, name it. I used to participate in everything. I joined for commerce at St. Xavier's College in Calcutta because a friend of mine was doing it. And when I joined college, I found everybody in the class was either studying for chartered accountancy or cost accountancy in Calcutta. And I went and enrolled. Not for one, but for both.
Birds of the same feather.
And it so happened that I passed both CA and ICWA. And then I had a deadline set by my mom saying, by June of next year, you better find yourself a job. You're not going to be at home anymore. So that's really what pushed me, I must say. Fortunately, I had my CA and ICWA qualifications at the same time, qualified, and I started applying. I still remember sitting on a wooden box, at a typing center opposite the General Post Office in Calcutta and sending out my resumes. It was a 5-6 page resume that I sent to Tata Steel by General Post.
Those are the days.
Those are the days. And it was. I got a Tata Steel job, which I must say I was very, very lucky.
This is the Rusi Modi era?
This was the Rusi Modi to JJ Rani era. But I would say a lovely place to start your career. I still remember the slogans written outside Tata Steel those days. They used to say, we make managers out of men, we also make steel. Yes. That was this.
In fact, that was a landmark. In fact, they did a beautiful TV commercial also, wherein they spoke about a lot of other things. And as a last, as an afterthought, we also make steel, It is beautiful. It is beautiful.
So yeah, a stint with the Tatas, but again, I think I felt that I was going to stagnate in Tata Steel when I was to sit outside a hall with a lot of other chartered accountants, and there would be my managers who were a good 10, 15 years senior sitting inside cabins. I said, it's going to take me 15 years to get into that cabin. I was getting restless. So again, I started looking out, and I applied to Coopers and Lybrand in Muscat. You know, as a chartered accountant, you're reading those manuals, the Coopers and Lybrand manuals. The name fascinated me. And yes, and landed up a job in Muscat with Coopers and Lybrand, and it's kind of restarted my career all over again in the Middle East.
So forgive the pun. So cabin pressure took you to international shores, huh?
It was actually a little more than that. Those days, I made something like 1,800 rupees a month as salary. I had a fancy two-bedroom apartment. It was called Professionals Enclave. It's the Tata Steel gave you. But when I did my maths, I found that if I was to buy a color TV and a refrigerator, I would be in debt for at least 24 to 36 months. Forget about buying a car those days. Yeah. So with that kind of money, I'm going to get nowhere in life. Forget about having a family and all of that. It was that sort of itch that said, no, I'm going to look overseas. And that's what made me move out of Tata Steel.
Fascinating, fascinating.
And one of the reasons I joined Ashmore was because they presented me an opportunity to create a good, high quality healthcare ecosystem in the Middle East. Okay, so, what Ashmore did is they tied up with the NHS Trust in the UK to make the UK standards of care available across the Middle East. So I said, here's a good chance to actually bring a brand like the King's College Hospital to the Middle East and set up good, high quality hospitals. And I think that's what we've done successfully over the last 5 years. If you look at the King's College Hospital, from a quality standpoint, I can tell you it's among the top hospitals here in Dubai today, at par with Cleveland Clinic in Abu Dhabi.
Cleveland is everybody wants, they say Cleveland, they know Abu Dhabi with Cleveland Clinic. Yeah.
The difference being, Cleveland spent something like $2 to $3 billion in setting up the 350-bed hospital in Abu Dhabi. And they set up a very nice hospital, and it's good. We did the Dubai Hills Hospital for less than $200 million. Okay, it's a for-profit hospital, but it provides the same quality standards that the $2 billion hospital provides in Abu Dhabi. So, to me, that's the way you deliver care, good quality care, and more cost effectively.
You have been the main leader of strategizing and putting everything together.
It's teamwork, not just me.
Putting things together.
Yes, definitely.
Strategizing, that's the brain behind
putting the pieces together. Yes, spent quite a lot of time on it. I enjoyed it, and now we are rolling out Kings across Saudi Arabia. We are actually working on India, Vietnam. So hopefully India will open in about 3 years' time, a King's College Hospital. So that's my journey. I spent the first 15 years of my career in oil and gas, FMCG, bottling for Pepsi, and then came into healthcare. So healthcare was again an accidental entry to take this company public on the LSE. That's where I learned my healthcare. I brushed it up by going to Harvard, did a program on healthcare delivery, more for healthcare speak than anything else. But today I would say the journey we've embarked on taking these British brands international is a very, very fulfilling one. I mean, I can see in Dubai, it's clearly from a quality standpoint, it's one of the best hospitals. If somebody was to ask me where should I go to, place I trust, these are the two names I would give: Kings here and Cleveland in Abu Dhabi.
So the way Cleveland and Abu Dhabi go hand in hand, Kings and Dubai now will go hand in hand.
Very much. Right? Much, yeah. It's set I would say it has set new standards of healthcare delivery in Dubai.
And this is last 5 years?
Last 5 years. Let me tell you something that I did recently. Okay?
Please.
So, a month ago, my wife and I trekked to the Everest Base Camp.
EBC1?
We did the EBC. I'm 62. She is mid-50s. And both of us trekked all the way to Everest Base Camp. Now, for somebody at this age, it's not.
It's tough at this age also.
It's tough, and we managed to complete it. There were 21 of us. So, yeah, for someone who's lived in the Middle East, and you're not exposed to a lot of trekking, and it's an easy life.
Comfortable life.
Easy, comfortable life. You're spoiled with everything coming to you on your table. You don't exercise too much. But for someone like that to be able to do an Everest Base Camp trek, the two of us, so we're very proud of that.
You
Kudos
should
to
be
that.
indeed,
Yes,
Pramod.
yes.
Excellent. That's brilliant.
So you have a wellness mindset already.
Yeah, and I'll tell you, it's come accidentally.
In the recent years?
Yeah. I would say in the last 10 years. So, I mentioned to you about taking this company public. That was one hell of a stressful assignment. Institutionalizing a place and taking it public on the London stock market is
First
one.
cleaning up and then institutionalizing.
Yeah, cleaning the place up, scrubbing it, and then taking it public is it's a lot of heavy lifting that one had to do, and very stressful. Going around selling your company to investors internationally meant taking on a lot of stress. Now, when a lot of that work was getting done, I could feel the stress on the body. Yeah, and it was from that I started embarking on things like yoga, and I joined up for some of these wellness programs. Yeah, I used to go for Ayurvedic massages, Ayurvedic treatments. I went to INYS in Bangalore. If you are, the naturopathy Jindal.
I'm a pass out from the HOD of Jindal.
So I went and did. We must have done it thrice. We did those 3-week programs.
Yeah, 21-day program. Yeah.
It's quite intense, but it all came out of feeling stressed from a lot of that work. Okay, and to me that was the starting point, because going to INYS and learning the yoga over there is something you then carry back. And then I discovered that when I was back at work, whenever I was stressed up, I would do some of those basic yoga exercises that I learned at INYS. And I'll say a lot of that has carried us through. The INYS, the detox program, you sometimes just tend to practice that at home. You've put on a lot of weight, or let me do a week of just fruits.
Fasting.
Fruits and vegetables, the INYS way.
Yeah.
And I think that's what helped us reach this stage without any serious ailments, if I may say.
And how has your experience been since you've encountered your, space in wellness in different parts?
It's especially in healthcare, it makes you more conscious. When you see people coming into your hospital really sick, diabetes and the kind of issues that comes once you become diabetic, people coming for cardiac surgery, people coming with gallbladder issues, and on, people coming for obesity surgery, it kind of reminds you that you better do something to yourself.
It's an alarm. It's
an
a red alarm.
Yeah. Otherwise, you're going to be one of those patients there.
And you see those patients each day in and day out. So it's a continuous red alarm on your...
Absolutely.
Yeah.
And then you start thinking about yourself, and then also about what can we do to prevent a person from getting to that position that he's in. You start thinking like that, And I mean, you will see in Kings in Dubai, we have a lot of preventative health programs that we've started. Okay. Health checkups designed to capture disease ailments early. In the sense, you get a full medical checkup done. If you have issues with cardiac, if you have issues with bone disorders, they will get captured quickly in those preventative health checkups. And then, of course, you let the patient know about this, and hopefully he fixes himself. We haven't gone to the other extreme of wellness programs in the hospital as yet, but we have started with a lot of preventative health checkup.
So you believe in the mindset of prevention is better than cure.
100%. And then when I look back, think of why did this not occur to me earlier? Okay, before I got into the rat race. Then you start thinking, it's a lot of it is habit building.
It is.
Yeah, and so when we were in school and college, no one really told us that you should exercise, you should eat healthy, you should meditate. None of that was sort of pushed onto you.
There was no such protocol.
There was, yeah.
It's not a part of our lifestyles back then, because back then things were pure. We didn't need it as much. Now we are all on adulterated foods, being organic, whatever. Still, there are a lot of adulterations that are there. Hence,
True.
Yeah.
So, I mean, I wish they would introduce things like yoga classes in school.
Mandatory.
Yeah, I wish they would bring in things like that. Meditate, give whatever religion you want to follow, whether it's you're a Christian, you're a Hindu or a Muslim, encourage a bit of meditation in children. Yeah. I think you will produce a much healthier society if things like that were added to the school curriculum of children. One is diet, consciousness about eating healthy, a little bit of meditation, and then things like yoga. Teach them how to do yoga, calm the mind down, and things like that. That would be, you see kids, poor kids with mental health issues and all kinds these days. Such a lot of it, stressed up environment.
Probably more than us.
The poor kids don't know what to go for.
Yes.
If they knew that, yoga helps calm them down, I'm sure a lot of them would quickly resort to doing a few pranayama exercises to calm their minds down. I think that's what is missing today. If something like that can happen, it will go a long way. I was talking about our hospital. After COVID, we saw our nurses really stressed up. I still remember a good 1-hour conversation with a British nurse of ours who was in the ICU during COVID. Imagine seeing patients die every few hours inside your hospital from COVID. Really, really stressed up. She left us and went to join a smaller place. And it was more like an exit interview to find out why she was leaving us. That's when you discover the amount of stress these healthcare workers go through. So it was from this that we started a host of programs inside the hospital to help mainly the nurses come out of the stress. So everything from yoga classes to creating all kinds of clubs across the hospital, a cycling club, a running club, a cricket club. We introduced, one of the things, people don't eat healthy, especially the nurses and all, they have to cook their own food. We said free breakfast for you in the morning. So come in before 7 o'clock, you get, the breakfast is on the house for you in the hospital. So they eat healthy. And then at every nurse station, we had fruit bowls placed.
Wow.
So, anytime they were tired, they wanted to have a bite, they would eat healthy. Those were the things we introduced at King's after COVID. And I'm sure it's made a sea change to the way people behave inside the hospital today.
This is unheard of. No, I don't. I have.
And all of this came out of COVID. I mean, yes, it was about how do you make this how do you help these people who are sort of putting their heart and soul and their lives at risk treating patients. And I'll give full credit to the HR guys at King's, and the guys have done phenomenal work. We would celebrate every festival. Things like Onam was with complete fanfare. We had a Mahabali come into the hospital. We had these Chenda drummers. We did that. We had even Zumba. What do you call it? Zumba Zumba classes.
So very de-stress.
Zumba classes. We have a cycling club which goes out. There are groups of 10, 12 that every weekend they're cycling on Kudra.
Al Kudra, very nice.
You'll see them do that. There's lots happening inside that small hospital from a wellness perspective for employees. I just saw the last annual day celebrations that they had. Everyone has come sort of, it's like a fancy dress thing. Come and party. One of our doctors is dressed as Charlie Chaplin. And you can see the fun they were having. But yeah, you've got to find a way to bring wellness into the workplace to make it a healthy working environment.
How much do you think is it important on a scale of 10? Workplace wellness.
8, especially if you're in healthcare, because the burnout rates will be much, much higher there. I mean, imagine all day long you're treating sick people. Okay, so you have the stress of all of that because God forbid something goes wrong, you will have a serious situation in your hands. You're dealing with people's lives. And then you come back home and you have the usual problems in life, right? Your money and children and husband and family back. You have all of that to deal with. To me, in healthcare, wellness is paramount. You have to address it. You've got to make sure that people are calmed down at the work level. They really enjoy the work, and you have to help de-stress them during the day. So, yeah, I would say very, very important.
So that dovetails, I think, quite nicely into my next question that I wanted to ask. So, whatever you actually articulated now reflects a lot of compassion, empathy, sensitivity, etc., etc. So, if you were to describe in one small line your leadership style, what would that be?
Good one. Yeah. So in healthcare, empathy is something you have to
It comes
have.
with the territory.
Yeah, it comes with empathy, and there are a couple of things. Empathy, respect is the other thing. No matter who the person in front of you, you've got to,
Irrespective of strata.
yeah, whether he's a sheikh or whether he's a laborer, you've got to treat them respectfully. So empathy, respect, and the other is no one person makes a hospital work. I could be the CEO, I could be anybody. I am not a doctor. I cannot treat a patient. You need a doctor, and you need the nurse, you need the radiologist, you need the lab, all of them to function to provide the right care to the patient. So the teamwork element in healthcare is very, very important. So to me, you need these three sort of ingredients.
Trifecta.
Yeah, you should be respectful at all times, respectful to your patients, respectful to your employees, and you have to walk the talk as the leader. You have to show empathy. Empathy to your staff, empathy to yourself also.
Yes.
Very important.
And definitely to the patients. So, and last is teamwork. The problem with hospitals is doctors have huge egos. Okay, and the reason why that ego gets built up in a doctor, they're all brilliant guys. In their school days, they're always in the front bench at school. And when they qualify as young doctors, everybody's looking up. You may be a 60, 70-year-old man, but you go and meet a 30-year-old doctor, you still look up to him.
Yes.
Like he's God. So that ego gets built up in them. So the key thing is to be able to manage a doctor and be able to make him work in a team with everybody else. And once you've cracked that, the hospital will work beautifully.
So that's your secret ingredient to
I would say, yeah, it's
smooth
understanding some of
functioning.
these key requirements. It's down to people management.
Absolutely.
Yeah, it's about knowing what makes the business work from a people perspective and sort of pushing these values into the hospital.
It's all about people in most places. It gets further amplified in a place like a healthcare ecosystem. I think it's.
If a leader doesn't understand these things, there's a big risk that he's either chasing money, yeah, and it's all money, 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 and loses the empathy side of things. Or yes, you'll still create a hospital, but you won't have employees with the right work ethic and things like that. I mean, I'm very proud of King's today. I think if you sort of checked with the nurses at King's, they love the place. Okay, they're treated with respect. And
Yeah, in fact, I go there to meet, as you know who, and you see the vibe, right? When people come down to the coffee shop at the lobby, there's a lot of,
Yeah,
they
there's
don't look,
energy.
yeah,
There's energy in the place.
exactly,
Yeah.
exactly.
So, amidst all the high pressures of top lines and bottom lines, what is that one key thing that has worked for you to maintain your calm?
To maintain my, I think that it is more in a nature. I never used to get stressed up generally. Okay. Maybe in the early days of my life, I trained to smile a lot.
So, that's that one
Okay.
thing, yeah.
Trained to smile a lot. And yes, at the cost of irritating my wife, she used to say, get that smile off your face. But yeah.
It was your survival. Smiling was
it
your
was,
survival.
yes. I think it helps de-stress.
Coping mechanism.
It's a coping mechanism. You get a problem, smile at it. You have an issue, smile at it. The moment you start smiling, everybody in the room starts smiling. Okay. I think it's a good stress reliever.
And you can't be smiling and angry at the same time. So, smiling overpowers everything at that moment. Yes.
Beautiful saying, no? Smile, it adds to your face value.
Yeah.
So, what are your ways of deriving positive energy with the power of discipline?
So one of the things I try to avoid is negativity around me.
How do you shield yourself from negativity?
Uh, I, I wouldn't be friends with the person if I've thought he was too negative. I mean, there are people who, are constantly complaining about politics.
They're born in the vineyard.
Yeah, the whining kind. I try and stay away from people like
Right,
that.
absolutely.
To me, that's
Gangrene.
So stay away from.
Always cribbing,
Yeah,
always toxic.
stay away from people like that. That's one. Okay, and then the rest of the time, you just enjoy yourself, have fun. In anything and everything you do,
Don't miss out on the fun.
don't miss out. Find the lighter side of everything. At my age, between our friends, we sledge a lot,
So you don't have to go to the Australian cricket team, yeah?
Yeah, we sledge. We sledge after every tennis game, the amount of sledging that happens. But everybody knows it's all for fun. And so that's the way we, I think, stay.
So let it
Detox.
out.
Let it out.
Not keeping it with yourself. Let the negativity
Yeah.
out.
And then you need to do a bit of prayer and stuff. So yeah, I'm a little old school. I would listen to the Venkatesha Suprabhatam in the morning.
That is a
stuff
part
like
of
that.
your routine?
Yeah,
Yeah.
kind of stuff like that. Small things like that. Occasionally, but not. It's not very.
Regimented.
Yeah.
Pramod, if you permit me a little bit of a curveball question. What have you learned from failures or insults which have made you a better person, an enhanced version of yourself, and probably brought out all of us have hidden potential which we're not aware of. Yeah. We need that purposeful provocation, time and again to do that. Any experiences that you would like to share?
As an accountant, the importance of ethics. In the Middle East, I think it's not just here, it's even in India, you will have bosses who tend to be unethical. Yeah. So one of the things I've learned along the way is the moment you see your boss is unethical or your employer is unethical, be brave enough to walk away from them quickly. Yeah, because it's almost like being surrounded by negativity. You know that he's not doing the right thing. Yeah. And then you're also part of that. You might need to do it for your job, for your salary and stuff like that. Be in that company. But my advice to anybody would be exit as quickly as possible.
Ethics is very important.
Ethics, yeah. Very, very important. It's if you find yourself surrounded or in an unethical environment, and it sort of starts affecting your conscience, you must tell yourself, I've had enough, let me get out of here quickly. I can't live in this environment for too long. It's not good for me.
It affects your health also in the
It,
long run?
it will definitely, it'll affect you because you'll have that guilt conscience always. So let's say you're working in a hospital that has a lot of malpractice going on. Yeah. Somebody's condition has deteriorated because the doctor is
Negligent.
Yeah. And yeah, if you're at the C-suite, you can say, I want this guy fired. You can say things like that. But if you're at a junior level, you can't do anything. You can probably do a bit of whistleblowing and stuff like that, but that's about it. But if you think you're in a situation where you cannot control it, walk away from those places.
What are the key points that you can attribute to professional success, physical health, mental health, and soul success?
Professional success, one, I would say, no substitute for hard work. Yeah, you have to, I was saying before, it's 99% perspiration, it's 1% inspiration.
Absolutely.
Yeah, so you've got to work hard. The second bit I would say is be prepared to take risks in life. Yeah, don't be too conservative at taking risks. I have traveled across various industries in my career, and each new industry presents a different set of challenges. In the end, business is nothing but plain common sense. Understand the industry well and you can crack it. Don't be scared of an industry, switch industries. But when you get into an industry, understand it thoroughly. What works, doesn't work in the industry, and then you should have an issue succeeding. So those are two. And the third bit is, of course, as a professional, what's expected from you is to make your business best in class. Okay? So whether you're running a retail outlet or whether you're running a hospital, you always want to be or help create an institution that stands out, is best of breed. So for that, you need to do a bit of research to know what is best of breed in your industry. So acquiring that knowledge very quickly to help your employer succeed is crucial.
So, hard work, taking risks, and knowing your business in and out. These are the three attributes. Let's go on to physical health.
Find a sport that you enjoy.
Finding a sport and doing it, playing it.
And playing it. No, you can't
So
become.
that's such a beautiful, and it's so simply put, because yeah, absolutely. Please go on.
Find a sport and that you will enjoy. And I'll tell you, it's never too late to start. Okay, find a sport you will enjoy, and go out. Find a group of friends who also enjoy the game, and play it regularly.
So, sport helps you stay fit and sane. Key points for better mental health.
This could be the believer in me speaking. Yeah.
We need more like you.
No, follow your God. Yeah, follow. I mean, as the problem with the more educated you are is you start sometimes
Questioning faith.
Yeah, you start absolutely. You're spot on. You start questioning faith, and don't do that. I mean, however educated or however big you may have become,
Reconcile with the fact that there is a supreme power.
absolutely. So follow your faith, and no matter what you do, you're going to have stressful situations. Yeah? You need a few tricks to get out of stressful situations, and I think pranayam. Maybe I'm saying this far too many times, but I think pranayam really helps.
Breath work.
Yeah, breath work. To get the stress out of your system, and maybe pick up a few tricks like smiling. If you find that smiling at yourself helps you relieve stress, try it out and see if it works for you. So look for some quick wins, I would say, to de-stress yourself.
That's a nice hack.
Yeah, I mean, a lot of people take
Look
a
at the
peg.
mirror and smile.
Yeah, a lot of people go for a drink and stuff like that, but then you're kind of harming your liver and stuff like that. But if things like the 5-minute pranayam exercises de-stresses you and you think it really worked, follow stuff like that. For some, it could be even a swim. A 15-minute swim might de-stress you. You find that
Or walk.
that routine. Yeah, a small trek, a weekend trek might suddenly clear the clutter from your head and be.
Being in nature. There are so many hacks, wherein you don't need to pay anything for that.
I think these days with media,
Social media especially.
Yeah, you see a lot of rubbish out there. Sometimes you can stress yourself up by just watching this stuff.
Yes.
Yeah.
But
So sometimes you'd have to have the discipline to switch off. What am I watching this again?
too much
and again
crap
for?
going on.
Too much. You can get sucked into it. Switch off from the stuff. It's just adding more stress to my head.
Creating boundaries and keeping your
Be aware
limits
of the
in
fact
place.
that any media today, irrespective of domain, geography, comes with the agenda of that if it bleeds, it leads.
Absolutely. So it's TRP. You must know why something is being shown again and again and again across all the channels, because they want viewership. Now, if you are falling into that trap and you're absorbing all that,
Yeah, absolutely.
You've
I mean, the
had it.
carpet bombing will continue. Talk about discipline. I think I would like to lead us into the next question. Just simple. Long distance marathoner or a chess grandmaster? Where do you see yourself?
Neither. A chess grandmaster is very intense. That's not what I am. Do I have the stamina for a full marathon? No. I'll do a 10K or a 3K.
Yeah, I think that's good.
Moderation.
10K is
Believe in
excellent.
Yeah,
10K
10K
is
or a
excellent.
3K, but I can't do. I will never do.
So, with so many different industries that you've moved on in the last 30 years, how have you trained your mind for a fresh start as you hopped each new industry?
It's a little easier if you're a finance person, okay? Because the moment you get into industry, you want to know how the numbers are built up for that industry. And then when you dig down deeper, you start questioning what works, how did those numbers happen? It could be a supermarket, okay? Why is the supermarket doing so well whilst another is not? What is it? The product lines in the supermarket? Is it the location of the supermarket? Is it the way the supermarket has been advertised? It's the same set of questions that apply when you look at a hospital. What makes a hospital successful? Is it the quality of care? Is it because of the doctors? Is it the kind of specialities you have there? It's like product lines. So the questions you ask in industry are all very similar. Find out what makes the industry tick, okay? And then you must know how to make it work the best. So for instance, in healthcare, let's take healthcare as a market. For a good successful supermarket, you must have quality products, right? For a good hospital, you must provide quality care. It's the same thing, but the product is different. The product here is the quality of healthcare that you're providing, quality of products that you're selling. Now, then the question is, how do you provide good quality care? It's through good doctors, it's through good nurses, it's through a well-equipped hospital. Very similar in retail also. Okay, it's getting the right product lines, it's proper shelving, it's making sure the products match the demographics in that area. Hospitals are somewhat similar. What's the disease burden in your community and catering for that? So it's understanding these nuances in that industry and then catering to it.
So it's a structure that you follow in every new industry. It's
It's the same thing,
it's
the same thought
thing
process.
with
The
different
fundamentals don't change.
parameters.
The fundamentals don't change, but you need passion also. When you get into any industry, you must tell yourself, I am going to be passionate about it.
So there's a
Okay.
beautiful book, Pramod. I'm glad you brought this up. It's titled Passion Capital. Your biggest resource in an organization is passion capital. Okay, because passion can overwhelm against all odds, win the day for you, I mean, get the right people associating with you, all that. You're on a line predominantly wherein, in any case, we are swarmed with data and analytics. Okay, especially within your space, there is so much of number crunching and everything that happens. Given where you are and where you spend most of your time, um, how much do you rely on gut instinct?
In the end, business is nothing but common sense. Yeah, it's about common sense and whilst you say feasibility studies and IRRs and all that stuff, actually, in the end of the day, a back of the pack exercise is good enough to take a call on an investment. So yeah, there's a lot of it is gut instinct. To me, it's common sense. You call it gut instinct, but it's just down to sheer common sense, and relating some of that common sense into
All those
economic.
accumulated experiences that have gone into the default, wherein you can actually draw on it.
Yeah, draw on.
It's like your bank, right? And a bank of common sense, probably, you know?
So, talking about gut instinct to gut health, what are the things that you follow for maintaining a good gut health?
So, after COVID, all of the entire house starts the morning with a concoction of herbs that have been created. So there is haldi pani, there is this and that. It's something that our maid prepares for us every day in the morning. The whole house has 1 cup of it.
Anti-COVID shot.
Yeah, it's like
Immunity shot.
it's an immunity shot with all kinds of, it's got
All your desi herbs.
all the desi herbs in it. We start off with that in the morning. I think that helps a lot. Then, of course, lots of water.
Hydration is very
Hydration,
important.
yeah.
Okay. And if you can stress on this concept of prevention is better than cure a little more.
Yeah.
You see so many times patients walk in with a tumor that could have easily been detected 5 or 10 years earlier. And if it was detected 5 or 10 years earlier, you could have operated on it and he would be all fine today. They come into the hospital too late. And that's what kind of drove me to this thinking that, health checkups is key. And we kind of take our body for granted, and which is a big mistake. And of course, sometimes it's financial also. These health checkups can be quite expensive. Not everybody can afford it. But then you look at things in India today. A blood test is a few hundred rupees only. You can get that done. So the more we can ingrain this thought in people is prevention is better than cure. Get a health checkup done. If there are any issues, address it quickly. Of course, it requires the right counseling also. So if you're getting borderline diabetic as an example, your HbA1c is 5.9.
You're already at sitting on the
pre-diabetes
edge.
level. You need someone to tell you how to fix it. One is how to fix it, and two, if you don't fix it, what are your consequences?
What are the disaster list?
What's going to happen to you?
In today's world and today's healthcare, can we integrate the concept of live a medicine-free life?
This is the dilemma a hospital operator will go through. Because if there are lesser sicker people, he will make less money.
Exactly.
Okay. Now, why is that happening? Because he's only incentivized to cure. He's not incentivized to prevent disease. Okay. Now, and this is where in healthcare there is this new concept coming. It's called value-based healthcare, where you're paid not only for curing people, but also for keeping them healthy.
Aftermath.
Before. So if you're given a population of 1 million people to manage, and they say, I will give you $10 million annually, you have to manage the 1 million people without any deterioration in their disease burden. Okay? If your reimbursement schemes become like that, then you will go out because if he comes to you, now you're getting $10 million flat. Now what do? You want to avoid people from coming to the hospital. So you will now go out to the population and say, let me check you all up on a regular basis. Because if you become more sick, I'm going to incur more costs and make less money, right? So it's called value-based healthcare, which is what is the sort of new way of
so in
reimbursement.
that concept, can this concept integrate?
Absolutely, beautifully. What that will do is, I as now a provider who's managing the population say, let me get all these guys into yoga, into wellness,
Teach them the concept.
into all these concepts to keep them healthy and not want them to come into the hospital. It's the whole reimbursement model. If that changes towards more value-based healthcare, you will see a healthier society develop.
That's a beautiful note to conclude this very, very interesting, engaging conversation with you on Pramod. Thanks so much for doing this, and we look forward to interacting with you in the future as well.
Lovely.
Thank
It was
you.
a pleasure. Yeah, very, very interesting conversation. I haven't had something like this for ages.
Oh, thank you, thank you, thank you.